It's my pleasure then to introduce our last engagement for today, a different engagement entirely. And in doing this, I'm going to invite Eleanor Rivoire and Andale McTavish to come and have a seat, and we'll have a chance to wire you up. Andale McTavish is the co-chair of the Patient Family Advisory Council of Kingston General Hospital, former English teacher, instructor, and she worked before in the standardized patient program, so she has a clear understanding about what it's like to interact in real life and in acting life with physicians. And Eleanor Rivoire, we're delighted, is standing in as the Vice President of Clinical Administration and Professional Practice and Chief Nursing Executive, meaning she runs most of the hospital in Kingston, as I mentioned earlier today, because Leslie injured herself and was unable to join us. So Andale and Eleanor, we're in your hands. Thank you.
I'm going to begin, and I'd like to begin by thanking you for a very warm welcome, and I'm very pleased to substitute for Leslie. Any of you who know Leslie will know that it would have to be something very significant to keep her away from this sort of event, but she agreed to me sharing that over Christmas she had a bit of an injury when she was skiing, and so she's dealing with a pain issue, and it just really makes traveling impossible at this point. So I can promise you that could she be here, she would be here, but I'm very pleased to substitute for her. Typically at KGH, the patient voice is actually the first voice that anybody in our organization hears. At the point of hire, as we welcome learners into our organization, when we are doing community presentations about different initiatives. And we're very proud of that fact. So we're departing from script today in that I'm going to begin to speak first, but we thought it was important to be able to give the context for what we have been doing at KGH. And then we'll sort of have a little bit more discussion. As I say, we're approaching it a little bit differently because it is the context that helped us realize what an untapped resource that we had with patients and the families that we are working with in Kingston. KGH's journey began with a period of investigation and supervision about 4 or 5 years ago. Many within the Ontario system are very familiar with it. Others probably were, because it was a bit of we were a lightning rod within the healthcare system for a while. We lost the confidence of our public, of our immediate community. We had very poor performance on a lot of the measures that should be predictably better. We had lost the confidence of our ministry. And so there was a very sharp awakening that change had to occur within our organization. We had to achieve a very substantial financial recovery as one of those pieces. It was approximately $30 million was set as the target that we had to achieve. And in doing it, we made a very clear resolve that in achieving that financial measure, we would not compromise patient care or quality. Arguably, some would say that we wouldn't compromise it anymore, and ideally that we would improve it and that we would improve the work environment for our staff. So that was the task before us. The work began with the recruitment, actually, of Leslie to the role as President and CEO, and in her work of building her senior team to guide the organization. It also began with the work of the board, and the board going through a refreshment and a learning again of the role of governance and the accountability of governance as it related to management. So you had a governance and management structure that we were actually going in the right and the same direction. When Leslie joined the organization, she, in her first 100 days, did a very close engagement with staff, but sort of a really quick review in that 100 days. But on completion of the 100 days, said these are the 5 areas that we are going to focus on within this organization. And everybody was set off with the resolve that these would be the things that we would work on. Immediately following began a more robust strategic engagement process and a strategic planning process. And in the course of that, there was consultation with over 1,000 staff within the organization and over 1,000 people within our community, be it the academic community, our healthcare partners, our patients, organizations that supported the community. And upon completion of that process, and after a validation with all who had fed this strategy and basically affirmed it was the right direction, the strategy was launched. While we were doing all of that, we were also getting patient feedback very directly through our patient relations program and in that engagement process. And we were hearing just how much we were failing our patients and community. We heard that they were afraid to come to our hospital, that they had concern about the safety, they had concern about the cleanliness, they felt disrespected and disregarded as they came into our organization. And so it was fortuitous as well that we had the opportunity to attend a Change Foundation session where Barbara Balick from the States attended, and she gave a message that was probably just perfectly timed to say that, you know, patient-centered care is not doing for and not doing to patients, which feeds all of our clinical and professional interests, but doing with patients. And that was a very significant turning point for us. And as we had patients give us the very horrible experiences, we also had patients who knew where we were going. They were willing to trust, and they came on board with us to be partners. And Andale was one of those individuals over 3.5 years ago. So I'm going to turn it over to Andale to tell you her story of becoming involved in what it means to be working in our organization. So Andale.
Thank you, Eleanor. Bonjour à tous et un grand merci de l'opportunité d'être ici avec vous aujourd'hui. 4 years ago today, I was admitted to the Kingston General Hospital to have a colon resection. I stayed 9 days, and I had absolutely no idea then how that 9-day stay would influence the course of my life. There was a lot to be grateful for in my experience. Hey, they took away my cancer. Very skilled surgeon, an attentive resident, excellent pain control, and generally adequate nursing. You'll notice a slight change in my tone when I say that. On the other hand, all those good things, the environment was dirty. The unit itself smelled unpleasant. I thought I would never get the smell out of my hair and clothes. Staff walked through the corridors loudly discussing a party last night. Very few people introduced themselves, and communication with my family was minimal. Although I wouldn't have put it in those words then, what I was longing for was someone to do something with me as a partner, not for me and not to me. Why come when I'm lying prone, open my legs without introducing yourself, and put white stockings on me? Why are you doing that? And what is your name anyway, and what do you do? Those were things I remembered even in my drugged stupor. During my stay in hospital, the hospital chaplain would come by frequently. I knew him socially, and I was, I suppose, quite verbal in my complaints or my description of what had gone on. He said, Andale, it's a perfect time. We have a new CEO, a new regime. It's a time for change. We're creating a patient family advisory council. Will you help us start it? At the same time, there was a person at my bed who said, I said to her, you know, I've heard there's a new CEO. Yeah, well, you know, it'll be like all the others. Nothing will get done. It's just the flavor of the month. Well, I'm glad to say I believe that this person was proved wrong. In February 2010, 3 patient advisors, myself being one of them, and 4 staff members were invited to create a patient family council. We currently have 12 members that sit around the table as advisors once a month, and 4 staff who meet with us, Eleanor being one. But these 12 are a very small part of a much larger group of 59 advisors who are on every committee in our hospital that has anything to do with the care of patients. There is a patient at the table. As people have said before, that changes things. Our voices are helping transform patient care. We started very small. We had no template for how to proceed. All we knew is we wanted to do something. First thing we started off with was my pet peeve, because I was loud. I could not tolerate being in the hospital, being drugged, and having to look at people's crotches to find out who they were, and even then there were codes. So things would turn around, I couldn't see who people were, I had no idea. And moreover, I couldn't remember. So we designed something that could be worn in an appropriate part of your body that tells who you are and what you do. And what we found is something that simple promotes better communication, more transparency, and more respectfulness on the part of staff and patients. Staff have said they like it very much because they know who they're working with. We have many nurses and many staff on the floors at various times. We designed a new patient information booklet. That took months and months and months of hashing over. So templates were given to us and we changed them. Wherever we felt that they were not understandable or not representing the patient voice. We tested new menus. We advised on wayfinding in the hospital. We have an old hospital and it's very hard to negotiate your way around. So we looked at all those kinds of things. We helped eliminate rules with visiting hours. Now people can come and go whenever they want to. And people aren't afraid to leave because they know they'll be allowed back in. And so there aren't legions of people coming in at 2 in the morning, but if you need to stay there with a loved one, you're certainly not prevented from coming back. We've helped educate over 2,000 staff members on patient-family-centered care to date. I think we have a few thousand more to go, and it's a wonderful thing to be involved with because I have direct contact with staff when I do that. We address all new hires monthly. So there's a patient-family advisor there to ask those questions about patient-centered care. And I have the real thrill, I love it, it's such a power trip, of being the first to introduce patient-family-centered care. I'm the first person to speak to all new residents as they come to our hospital in July. And then I see them in clinics. And they say, "Do we know you?" And I say, "Be very afraid." You know, I'm not an adversary. I'm not an advocate. I want to partner with you. I want to walk that road with you and give you all the help I can, because I certainly expect a lot of help and support from you. Now, I won't keep you too much longer. You're probably saying, "Oh, well, she's done a horn and blown a horn and done this and done that. Where are they going now?" We're very conscious that we can't rest. We have to embed patient-centered care so fully into our system that it's independent of any few individuals. We're becoming an organization who's able to hear and act on criticism. Our patient satisfaction is up, but guess what? Our complaints are up. And I say yay because I think we're creating an atmosphere where people can say, "This went okay, and that didn't go well for me at all. I felt XYZ when that occurred, and I don't think I'm going to be punished for it." Yay. So one last thing that I find immensely exciting is patient-family feedback forums. So every unit in our hospital, at least once quarterly, will have a session with a former patient family member who has been treated on the unit, and that person will come back and have the chance to share his or her opportunity, an opportunity to share his or her experience with the people or the team that looked after them. And to do so in a non-accusatory manner, but to do so in a manner that we hope is helpful. Then the unit has the responsibility of taking that information and working with it. So I find that a very, very positive thing. I intend to have the last word, but Eleanor, you go ahead. I'm sure there are some more things you want to say. Just give me
Yes,
2 minutes.
Yeah, 1 or 2. And I'm sure as you hear Andale, and multiply Andale by 59 in our organization right now, and you begin to have a sense of the passion and the willingness that comes to the organization. When I realized it was a group of CEOs that I would be speaking to, I thought, okay, as a leader within our organization, what are the things that I really thought were the winning conditions to support this occurring? So I just want to share a few of those. One is I cannot understate the value of having a strategy that has been developed, a strategic plan that truly is a guiding tool to a document that isn't shelved, that is actually used every day, that staff understand, and that guides an annual plan for the organization every year. It absolutely has everybody sort of working in the same direction. And when your strategy says your goal is outstanding care always, and your first strategic direction is transforming the patient experience through a relentless focus on safety, quality, and service, and you know that you can garner the whole organization around that, you know that it's going to begin to have the change that we needed to make. So the strategy is clear. The importance of aligning all work and having clear accountabilities and alignment of those accountabilities and work to the strategy is key. It means that when you are assigning resources within the organization, it becomes clear the resources go to the work that is going to advance the strategy. And if you're embedding the voice of the patient and the perspective of the patient every step along the way, then again, you know that your direction is going to be pretty solidly in the right direction. There always needs to be the flexibility to course correct, but I think that alignment of accountability, alignment of resources, and the engagement along the way is key. The values that we have and principles that are articulated in our strategy are also key ways of defining how everybody in the organization is expected to work. And everybody in the organization means the staff that are hired, the staff that are credentialed, the advisors, the volunteers, anybody coming to be present for the patients. And those values are respect, transparency, accountability, engagement, and value for money. So I was pleased this morning hearing how all of those sort of affirm the work that is going on. We also learned that it's critical to be sure that as you say you're doing something, you need to demonstrate that you in fact are doing it. We were identified as an organization that was data rich. We probably had more data than, we knew we have more data than we can ever use. It was not being translated to information that actually informed changes that were necessary and being used in a meaningful way to measure it, to determine whether we were making those improvements. So with the input of the Patient Family Advisory Council or advisors at program levels, the organizational metrics, the quality improvement plan that's a requirement with our ministry, and all of the performance agreements that are signed within the organization have these expectations built into them. So again, it becomes a very strong link. I think it's important to appreciate this wasn't effortless. It does require resources, and it can't be done off the side of somebody's desk. But it does not require additional resources. It's where you need to look at what work is being done. We were spending an inordinate amount of time and a tremendous waste of money on doing things poorly. We reinvested and we redesigned. So, but the support that goes into supporting a patient advisory program is critical. not everybody was on board at the beginning. You can appreciate there'd be a lot of skepticism, and we get asked about particular groups, but I would say skepticism was throughout the organization and at every level. Nobody was immune to it. But what was so helpful is that we had champions who were real risk takers, who were change agents, who had the vision. And listening to Minister Horn this morning, they had endurance. And they felt strongly about it, and they weren't going to let it go. And what was also wonderful is that we had leaders who did not get in the way. We didn't have this all scripted at the outset. And Andiel says, like, the advisory council started with advisors before there were any terms of reference for it. So people didn't get in the way of some of the work. And I think that's a really key learning. It didn't take long for people to recognize that this was the way it was going to happen. So, and I think that's a really important lesson again. If anybody thinks that patient family-centered care and patient engagement is the flavor of the month and this is going to disappear, I just don't believe it's so, and I haven't really encountered many who do. And with social media becoming the way it is, the voice of patients and the perspectives are going to become even stronger. So the partnerships are just so critical to us right now. There is no doubt in my mind that the advisors became the catalyst to the movement within our organization. They're objective. We've been really very deliberate saying, if they begin to talk like us all the time, then we're in trouble. You have to have a little bit of dissonance to be sure that it's authentic. But they do not come in with presumed conclusions. They come in and they're willing to learn with us and to teach us. And so the partnership is strong. What began as a journey of necessity for us, and I wouldn't recommend it to anybody, quite frankly, but it was a journey of necessity for us, has become a journey of choice. And we know that we weren't the first to move into this journey. We learned a lot from our colleagues in the States. We learned from different organizations in Canada. And we just thrill at the notion that there's sessions like this today and the opportunity that we are getting more and more to hear from organizations who are doing this in different ways, because that's where the rich exchange of knowledge is going to be key. The overall impact for us, I think, has been profound. Our culture within our organization has changed. Patients who came into our organization 4 years ago say when they come back in for whatever reason now, they can feel the change. Our staff talk about the change. We know the capacity for change within the organization is greater, and we have basically the equivalent of more than 2 full-time equivalents from our advisors alone, and I think that is grossly underestimated as an infusion of intelligence and energy. And we know our outcomes are better. Our performance improvement plan concluded last year. We balanced our budget. We had a capital budget that we could actually infuse into the organization, which had not existed for years and years. Our safety measures for patients were improving. Our turnover rates were decreasing. Our patient satisfaction rates, as Andiel said, we were low. All of them are trending in the right direction, and we now handily exceed the Ontario Teaching Hospital average in terms of our overall patient satisfaction. So while our complaints go up, I interpret it much as Andiel does, that we have a community that says, it's okay, actually. I'm not afraid now. I might have my concerns, but my fears are less. And so I think that we are far from done our journey, and it's far from perfect in our world, but we are definitely better than we were 4 years ago, and we are not as good as we will be at a system level or at an organization level 4 years from now. And as said, I usurped being the first voice this afternoon, so Andiel is going to be the last voice.
May it be so. May it be so. I have to stand up when I say this because I used to teach and I don't feel comfortable sitting down. Just to leave you with a few messages for everyone in the room, and then one especially for CEOs. For all of you in the room, start small, start anywhere, just bloody start. CEO and senior management support is essential. Without that real support, not interference, but without that real support, we're not going to get anywhere, really. We need the buy-in that's pushed through the senior administration till finally people begin to be converted. We all know, people have said here today, cultural change is complex. Think of your own lifetimes. It takes time to realize the benefits of cultural change, but never, ever, ever give up. You can drive change. You absolutely can. And as CEOs driving change, I would ask you to, or share with you the credo that we developed as patient advisors because we couldn't remember the long definition of patient-centered care. We translated it down into hear me, respect me, work with me. Je vous remercie.
Thank you so much, Andale and Eleanor. It's a wonderful note on which to end, and since I'm sure you're going to be joining us for a glass of wine afterwards, people are going to have an opportunity to talk to you even more about this fantastic journey that KGH was sort of propelled onto for perhaps not the best of reasons, but nonetheless, you have more than proved the hypothesis behind this meeting, which is that patient and family-centered care is much more likely to lead to good care, integrated care, and indeed greater efficiency. So thank you ever so much. And it's well appreciated. And thanks to all of you for joining us today, and to the organizers on my own team, Linda Piazza and everyone else. It seemed at one point all of us was somehow or other arranged in organizing this particular meeting. I know that at our place every single person had an opinion on this meeting. And thanks also to Sally Clifford and Face to Face, our intrepid conference organizers who year after year provide wonderful service to all of us on the logistical side of this meeting. And most important of all, Terry Sullivan, who adeptly chaired this meeting and kept a light but effective managerial hand on our wonderful speakers. So thank you, Terry. Thank you to all the speakers, to all of you who have come. Un grand merci à tout le monde et merci encore Andale et Eleanor. Alors, et maintenant, il faut jamais oublier l'évaluation. Alors, on dit toujours qu'on aide les organisations à évaluer, etc., mais c'est nécessaire pour vous de nous aider à évaluer cette séance, ces séances aujourd'hui. And after that, I'll be delighted to join you outside the doors for a glass of wine. Thank you, merci, voyagez bien.